everyone, this is Holly Knudson. I'm a holistic cancer coach, and today I want to talk about trigeminal neuralgia. I actually had someone comment on my blog that they would like me to do a video about this, so here goes. Trigeminal neuralgia is a painful condition that affects the nerves in the face. It's also called tic-douloureux. The human body has 12 pairs of cranial nerves that pass through small holes at the base of the skull. And these nerves relay information from the brain to various parts of the body. In this video, I'll uncover some of the factors that can trigger trigeminal neuralgia. The trigeminal nerve is the fifth pair of cranial nerves that run down each side of the head. It's responsible for facial sensations and motor functions such as biting and chewing. Intense pain can result from disorders in the trigeminal nerve. People who suffer with this describe the pain as electrifying, sudden, and sharp, and that's because it's nerve pain. Bouts of pain often lead to anxiety because the person is always anticipating and dreading the next attack, and that's how painful it is. Now I want to talk a little bit about the facial nerves. As its name connotes, the trigeminal nerve is made up of 3 branches, also referred to as divisions. Number 1, the ophthalmic nerve, which is purely sensory and involves the eye, upper eyelid, and forehead. Number 2, the maxillary nerve, which is also primarily sensory, and it affects the lower eyelid, upper lid, and gum, cheek, and nostrils. Number 3, the mandibular nerve, is both sensory and motor and controls movement in the jaw, lower lip area, and gum. Typically, disorders of the trigeminal nerve affect only one side of the face. However, this isn't always the case. Bilateral trigeminal neuralgia is a condition where pain is felt on both sides of the face. The location of the pain depends on which of the 3 nerves is affected. So is it the ophthalmic, maxillary, or mandibular nerve? Pain caused by trigeminal neuralgia is not your garden variety type of pain. In fact, this type of facial pain can be so severe that it's actually referred to as the suicide disease. Before effective treatment options became available, people with this condition would resort to suicide to escape the unrelenting pain. The firing or short-circuiting of the nerve is what causes the intense pain. Some patients equate the unbearable pain with that of a screwdriver being rammed into the side of their face. I know, sorry for that visual. Because the pain is so severe, you have to do something about it. It's not something that can be put on the back burner and dealt with later because it's so acute. And here are some of the features. The pain comes on suddenly. It's described as electrifying and shocking. It's sharp, stabbing, and burning. It can be unrelenting and severe. Common pain medications are not sufficient for people suffering from trigeminal neuralgia. They just don't kick the pain. It usually involves only one side of the face, with pain concentrating in the cheek, jaw, teeth, and lips. There is first division pain in the forehead and eye area, but this type of pain occurs less frequently. Pain may last for only a few seconds, but could last for several minutes or even an hour, and even worse, it can be constant. Pain can be triggered by simple activities like applying makeup or brushing your teeth. Eating, chewing, laughing, and excessive talking are all potential triggers. Pain may get worse over time, with the attacks happening more often. Remission can occur where no pain is felt for a significant period of time. The most common cause for this type of neuralgia is pressure on the trigeminal nerve caused by a neighboring blood vessel. As we age, our arteries elongate, which creates possible contact with the nerves. This contact can degrade the myelin sheath that surrounds the nerve fibers. Myelin sheath is crucial in order to insulate the nerve. Without this protective coating, nerve fibers can short circuit and cause the pain that is associated with trigeminal neuralgia. This is why it's most often seen in people over 50. Interestingly, women are affected more than men, with elderly women being at the highest risk. Those suffering from trigeminal neuralgia may initially believe their pain to be the result of previous dental procedures. Some will even get root canals and teeth extracted, hoping to get to the underlying cause of their pain. So dental problems should be ruled out as a likely cause. Neuralgia pain can also resemble the discomfort associated with an abscessed tooth. And if you've ever experienced an abscess on one of your teeth, you know how painful that is. This gives you a small glimpse into the severity of the pain that trigeminal neuralgia can cause. More serious causes of trigeminal neuralgia could be related to myelin sheath damage incident to multiple sclerosis. A tumor pressing on the nerve is a less likely cause, but one that needs to be ruled out, as should any kind of facial trauma resulting from an injury, accident, or any surgery involving the mouth or sinuses. Injury to the trigeminal nerve itself should be investigated, as well as the possibility of a stroke. An MRI would be a good diagnostic tool in these cases. Viruses that lie dormant in the nerve root are also implicated in trigeminal neuralgia. Viruses can become active when the adrenal glands are stressed. So the take-home message here is to address your adrenal health to put the virus back into remission. Another condition associated with a dormant virus that has become activated is shingles. As I said before, trigeminal neuralgia cannot be ignored as the pain can be debilitating. Medical treatments include Tegretol, which can suppress the pain entirely in some people. Like any medication, though, there are side effects, and higher doses are needed over time to suppress the pain. Lyrica and Dilantin are other prescription options. High doses of Dilantin are used to treat unrelenting acute pain that needs to be addressed immediately. The downside to prescription meds is that they may stop working over time, resulting in the need for higher and higher doses with increasingly more side effects. And this can include memory impairments, dizziness, and an unsteady gait. At this point, other alternatives should be considered. Microvascular decompression is a microneurosurgical procedure that is one such option that is proven helpful in many cases of trigeminal neuralgia. A small opening in the skull is made to determine which artery is pressing on the trigeminal nerve. The pressure on the nerve is relieved by moving the blood vessel aside and placing a pad to ensure that no further compression occurs in the future. The affected nerve can then heal and the myelin sheath regenerate. The majority of patients obtain complete relief after surgery. However, pain can return in a small percentage of people. Gamma knife treatment is a form of focused radiation therapy that uses a laser beam to target and radiate the trigeminal nerve, which results in diminished sensation. Radiation to the nerve stimulates a healing process, which can restore the insulation on the nerve fibers over time. Pain relief is not immediate and may take a few weeks to notice a difference. This is a non-invasive treatment method that can be done on an outpatient basis. The numbness created by gamma knife treatment, while providing welcome relief from the pain, could potentially lead to permanent numbness. Unfortunately, pain often returns in up to half of patients after a few years. Procedures are also available where needles are inserted into the face to heat or compress the nerve using a microballoon. While these techniques don't carry the risk associated with surgery, recurrence of pain can be quite high. Complementary treatment options like homeopathy, acupuncture, and meditation may prove helpful in conjunction with medical treatments. Trigger point therapy, also called pressure point therapy, is also worth trying. This therapy involves pressure being applied to the non-affected side of the face. A measure of relief can often be obtained by massaging the nerve branch on the opposite side of the affected area. However, this technique must be done at the first sign of pain or discomfort. In summary, if you are experiencing sudden, intense, and debilitating pain on one side of your face that is concentrated in your cheek or jaw area, schedule an appointment with your doctor to determine if you have trigeminal neuralgia and to consider your treatment options. Have you experienced the pain of trigeminal neuralgia? Let me know in the comments section underneath this video. Thanks so much for watching.